Hello everyone, welcome to my video on challenging topics or challenging concepts on the topic of special senses, part 1. So this is chapter 15 in the Merriam textbook. So let's first be able to recognize the 5 special senses. Those are going to be vision, sense of taste, sense of smell, hearing, and sense of equilibrium. So special sense receptors are located within distinct areas within our head. So we'll start with the conversation on vision. So eye and vision. So we have 70% of our body's receptors, total body's receptors are found in the eye. So 70% is going to be there. So we have a lot of accessory organs and structures that help to protect and help the functioning of the eye. So the eyebrows helps to keep the sweat away from the eyes. Eyelids again protect us from anteriorly, whether it's dust, dirt, or any other objects coming in. Conjunctiva, this is a transparent mucous membrane that's on top of the sclera, the white of our eye, which is called bulbar conjunctiva, and then we also have conjunctiva at the inner side of the eyelids called palpable conjunctiva. So if anyone suffers with pink eye, it's conjunctivitis, it's an inflammation of this membrane. We'll talk about lacrimal apparatus. Lacrimation is to tear. So our tear glands are located on the superior lateral side of each eye. So this eye would be this person's right eye. Those are the tear glands. Tears will be produced lacrimation. Tears are a dilute saline solution which contains antibodies, lysozymes, and even mucus. They will be spread and they will flow in this direction and flow to the medial aspect of our eye, where we will have the lacrimal sac. And from the lacrimal sac, they'll use the nasolacrimal duct and it'll drain into our nasal cavity. Generally, we don't even notice it. It's just a little bit that cleanses, that cleans our front of our eye, and it drains out. Okay. Next, we're going to talk about the 6 extrinsic eye muscles. 4 of them are straight, so they're called rectus, and then 2 are oblique, and it's all named after the location of those eye muscles. Please note that 4 of these 6 are innervated by the oculomotor nerve, and that's cranial nerve number 3, while the superior obliques by cranial nerve number 4. That's going to be the trochlear nerve, and then lateral rectus is stimulated innervated by our abducens nerve, cranial nerve number 6. Another thing to note is the superior and inferior obliques, they're basically antagonistic to their pair of the recti muscles. So superior oblique will be antagonistic to superior rectus, while inferior rectus will be antagonistic to the inferior oblique muscle. It has to do with the way of the attachment point of those muscles. So that's superior oblique. It attaches obliquely onto our eye ball. So next we're going to talk about the lens. Lens is a biconvex, so bulges outwards, transparent, flexible material. It is avascular, so it doesn't have its own blood supply, so it depends on the aqueous humor for its supplemental needs. As we age, we can develop cataracts. Cataracts are basically cloudification of the lens, beg your pardon. It becomes less elastic as well, and this does not allow any light to pass through. That's why it's white in color. It's a normal process of aging. Some conditions can speed this along, like diabetes, as well as smoking. And if the occupation or hobbies involve a lot of sunlight outdoors, this can also lead to the cataracts appearing at a younger age. It's a very straightforward fix surgery. It's a minor surgery. They put a little incision liquefy the lens, suck it out, and then put an artificial lens. It's basically like a contact lens with springs to them. The function of the lens, of course, is to help focus our image, focus of the object, the image of the object on our retina. Next, we're going to look at the internal chambers. So basically, the lens is the landmark that divides the internal space into cavities and segments, right? So anterior segment is from the anterior of our lens towards the cornea, while the posterior segment is from the posterior surface of the lens to the retina. Within the anterior segment, we have aqueous humor. Aqueous humor is a liquid-like. It's basically a filtrate of blood plasma. It's produced by produced within the ciliary process, so the blood capillaries there will produce it, and then it fills up the anterior segment, and it will drain at where the sclera meets the cornea. It's called canal of Schlemm. This supplies nutrients to the lens as well as cornea, very important because both of these are avascular, but also can provide some nutrition to the retina. You may have heard of glaucoma. Glaucoma is this fluid, the pressure in the eye that's described as pressure in the eye. That's because of this aqueous fluid. Either we have overproduction or under drainage of it. Then within the vitreous, within the posterior segment, we have vitreous humor. It's a gelatinous-like material. It holds down. The basic function of it is to hold down the retina, so it can remain attached to basically the pigmented layer, but of course as well the underlying layer, which is the choroid as well. This has to last a lifetime. So if we lose it, this lasts a lifetime, whereas the aqueous humor is continuously produced and drains. It's very similar to our CSF in the brain and spinal cord. So next we're going to talk about the walls of the eyeball. Wall of the eyeball, it has three layers. The outermost layer is a fibrous layer. It's made up of sclera and cornea. The middle layer is a vascular layer, and then the inner layer is a retina. So let's go over the fibrous layer. It's avascular, so again depends on the underlying layers or the aqueous humor for its nutritional needs. Sclera is the white of our eye, okay, and that helps the shape of the eyeball as well as for those extrinsic eye muscles to attach. While cornea is a transparent region in the anterior portion of the eye. The function of this is to focus, help to refract the image, bend the light, and this actually has a higher refractive power, the highest, higher than even the lens itself. Hence, if we suffer with some refractive problems, it's on the cornea that they would do the laser eye treatment on, if you were to have that done. Then next is the vascular layer. There are three parts to it. It's pigmented, and of course, as the name suggests, it has a lot of good blood supply. The first one is the choroid. Choroid lies directly underneath the sclera. So its function is to supply blood supply not only to itself, of course, but to the sclera on top, as well as the retina underneath. Ciliary body, we mentioned the ciliary process, which is a part of this, and then the ciliary muscle, which holds our lens, okay, and helps shape the size, the shape of the lens as well, help control the shape of the lens as well. While the iris, the last part of the vascular layer, is the colored part of our eyes. The opening in the iris is called pupil. So the basic function of the iris is to control the size of the pupil, which thereby controls the amount of light, which we will look at next. And retina we'll look at after in a couple of slides. So the iris itself is made up of two sets of muscles. One is called dilator pupillae, that's radially outward, and then a sphincter pupillae closer to the pupil. Like any other sphincter, it's going to be circular muscles And if you recall, in the parasympathetic, we have pupils which are constricted, hence it's the sphincter pupillae which will contract and the pupil size will decrease, while the dilated pupillae is relaxed. Then during a sympathetic response, the dilated pupillae contracts while the sphincter pupillae relaxes and the pupil size increases. Please note, when we're looking at a close object, an object very close by, or when there's a lot of bright light, it will be the parasympathetic response that we will see. Similarly, when we are focusing on an object far away, or if there is dim light, it'll be the parasympathetic kind of response that we will see. So on this slide, we can see a view of the eye. So the lens, anterior to that is the anterior segment, all the way up to the cornea. Posterior to that, all the way up to the retina, is the posterior segment. Within the posterior segment, we'll have vitreous humor, gelatinous-like substance. Within the anterior chamber, we will have aqueous humor. Layers-wise, that's the sclera, white of our eye, and then the cornea here, both of which are the outer fibrous layer. Then we have the choroid, the red one here, ciliary process, or ciliary body rather, and then we have the iris, all three making up the middle vascular layer. And then yellow in this diagram would be the retina. So we're going to talk about the retina next. Retina itself has two layers. The outer pigmented layer, the function of this is to absorb light. So once it passes through the neural layer of the retina, we want it to be absorbed in and not reflected back onto the neural layer of the retina. It also has the capability to phagocytize the outer portions of the photoreceptors. The inner layer is the neural layer. This contains those sensory receptors as well as other neurons. So it's the three most important ones of this is going to be our photoreceptors, then the bipolar cells, and the ganglion cells. In terms of information that travel, again, it's not the impulse only, the action potential is only produced in the ganglion cell. So information goes from the photoreceptors to the bipolar cells, then to the ganglion cells. And we'll talk about this in the part 2 of the challenging concepts on this topic. So our photoreceptors, we have 250 million of them in our eye. Rods and cones, we'll go into the details of what they are shortly. In a couple of slides, we'll talk a little bit more about them. Fovea centralis, found at the center of the retina. When we are concentrating on an object, that object will be focused right on this fovea centralis. Fovea centralis contains just cones and hence gives us the sharpest image. The optic disc is where the optic nerve leaves, and the optic nerve is made up of the axons of our ganglion cells. So the action potential, the information leaves the retina, goes towards the brain, and they leave in the optic nerve. And at the site where they leave the retina is called the optic disc. At this site, there are no photoreceptors, and hence it's a blind spot. So any image that falls on this spot cannot be seen by the brain. Is not processed by the photoreceptors. The brain sometimes puts in that information using the other eye and also information surrounding it. So we still don't see spots blank because of this in our vision. The retina has two blood supply. It gets its blood supply from the choroid, as we mentioned earlier, but it also has its own blood supply. An artery called the central artery enters the retina together with where the optic nerve left. central artery and veins come through there and then supply the retina as well. In this image, the one on the left has eye. Light is coming in this direction, and then they have enlarged this portion in this picture here. So light will be traveling in that direction. What you can see, first let's see, is the optic nerve. If we follow it along towards the retina, it will be the optic disc. There are no photoreceptors here, hence the blind spot. The blue and yellow are our photoreceptors, rods and cones. Then it would be the bipolar cells. Then it would be the ganglion cells. So light goes through these cells or past these cells, hits the outer portion of the photoreceptors. Information goes from the photoreceptors to the rods to the ganglion cells, and then the ganglion cells' axons become the optic nerve, and information travels along. So you may have heard of the best vision as being 20/20. The reason for 20/20 vision is in a relaxed state of our eye, flattened lens, pupils dilated. We can focus on an image 20 feet away. Okay, that's why it's called 20/20, not 5/5, 10 or 10 or anything like that. Okay, it has to do with this piece of information. When we focus from a far object to a close object, three things happen. Something called accommodation happens, then constriction and convergence. Accommodation is the change in shape of the lens. This is because of those ciliary muscles that will make the lens more rounded and hence will refract the light even stronger, so to speak. Constriction, this is pupils are constricting. This way we are focusing on that image that's close by and not getting distracted by the peripheral view. Okay, and then convergence, you may have heard of this term, or you can think of traffic. Either we diverge or converge. So convergence are coming together, so that the two eyes will converge towards. So they are moving medially, and hence can focus on the image, on the object. The last thing we'll talk about in this video is some problems with the refraction. Myopia, it's also called nearsightedness because patients who suffer with this, people who suffer with this, can see close. They have trouble focusing on objects that are far further away. It's said that they have an eyeball that's too long. The lens does not focus the image on the retina, but a little bit in front. Hyperopia is the other side of the flipped of the coin, if you will. These individuals are far-sighted, so they cannot focus on images that are close because they are said to have eyeball that's too short, and the lens focuses the image behind the retina. So we correct myopia with concave. So the rays will come out further away, so they can be when they refracted by the lens and the cornea, they'll be right on spot. While hyperopia is corrected with a convex lens. Astigmatism is when cornea or lens is a little bumpy, so they're not smooth, and these can be corrected with something called a cylindrical ground lens. Presbyopia, that is the loss of the elasticity of our eye as we age, hence lose the ability to focus on objects that are close to the eye. So you're going to see people who suffer with this moving whatever they're reading, whether it's a textbook menu, a little bit further away from their face, and this can be corrected with a convex lens, which is the reading glasses are convex lenses as well. I hope you found this video useful. Please, I encourage you to watch the second part of it to understand the rest of this topic. I hope that you have a great day. Have a great day, everyone.